I have three children, a teenager and two younger children who are now 8 and 7. But my husband is visually impaired, so he is limited in his driving abilities to get to anywhere. I work full time, so if I'm not available to drive us, then they're kind of in a situation where they are stuck. So I think that makes us probably unique from most families. Prior to using Table Rock, we would have to go to an urgent care or an ER. We'd have to decide which one could get us and the fastest and accommodate our needs the best. Last time I actually went into an urgent care physically was when I thought my 5-year-old had an ear infection. Last thing he wanted to do was get in the car. Got him in the car, sat in the lobby well over an hour before we were seen. They looked at his ear, wrote a prescription. I think the whole travel time to the urgent care, to the pharmacy, all of that was probably close to 3 hours. Time, travel for us. Travel is a big one. For if my husband is a stay-at-home dad, but with his visual impairment, if there's a medical need for him or our children, the ability for them to get to an urgent care is limited. So just getting to a physical, actual urgent care, having the time, and then of course, your kids feel awful. The worst thing they want to do is get into a car and go somewhere. What we need from a healthcare provider ranges everything. We've had everything from now we'll use like for seasonal flu shots to be able to vaccinate us all at once in our home instead of trying to drag everybody in individually. We've needed it for sutures, ear infection, influenza. We need it when we're sick, and especially on those times where you're wondering, does this warrant a visit? So you drag your whole family out of the house and then you get there and it's nothing that even is treatable or a concern. So even somebody to come help you troubleshoot what's going on, give you some ideas of what to do. So a wide range of things. My primary care physician is a nurse practitioner who I go see regularly because nurse practitioners focus on a holistic model of a person rather than a medical treatment model, which are both very important, but personally I feel like the nurse practitioner kind of incorporates all of that, not just a textbook medical treat the problem. They kind of specialize more in treating the whole person. Oh my gosh, a ton. Stress-wise for me, multiple times when I've been at work and my husband has an issue or thinks the kids aren't sick and I'm not going to get off for hours, for someone to be able to come into our home who you trust, who has worked in the healthcare community and take care of your family in their home is big. I definitely feel that way because there's this sense of, are you overreacting? Are you this? But it's nice. I do think sometimes people don't get the care that they need because they don't want to go physically into an urgent care or an ER. So they delay the problem, wait, and people get more sick because you're just on the fence and you don't feel like hassling with that. So it definitely, I feel like we've expedited care, caught things sooner, where in the past I might have let it drag on a little bit too long just because I didn't want the inconveniences of an urgent care or an ER. You don't have to drag all your crying kids out of the house to go sit in an urgent care for 45 minutes for an ear infection, or like I had an ingrown toenail that I didn't have time to go get taken care of, so I was able to get it taken care of in my home by Table Rock with my kids here, when I would have probably just let it keep going, like I said, getting worse. It doesn't matter if your house is clean, it doesn't matter if kids are running amok. It's very friendly, personable. Don't feel like you have to get your house in order before you have somebody come, and it will say it's a huge stress relief.